We will start with chapter 10 tonight, chapter 11 and chapter 13. These two chapters are a little bit longer than the chapter 10. That is the reason that I split the chapters. Otherwise, we'll be here until 1 a.m. into the morning. Yeah, I don't want to spoil the Friday for some. Let's go over here with chapter number 10 immediately, alterations of the immune function. I already told you that I will ask this particular definition defends the body against the invasion or infection by antigens. Obviously, the immune system make a beautiful group of troopers that basically destroy abnormals or damaged cells in your body. Meaning that particular definition, somebody will see it as a true or false question. Problem over here, and this is what I said to the three classes, is that I have huge amounts of information. What I will present today is the universe of all the questions that will showing up in the test, in the test. But I need to remind you, not necessarily everybody will see all the questions. Now, what is the responsibility of the student to be prepared as possible? Because in case that you see the question that I present over here, you will be ready. Again, you will see all the questions. All the questions are very different in the four tests, but this particular question will show up in one test of four. Moving on with the next one. The types of alteration, I decided to remove this one out. Basically, is another part of the introduction. But we already know that when we have a problem within our immune system, exactly what I explained in the class, is when the immune system work excessive or when it's not working at all. That is easy to rule out over there. That is the reason why I didn't ask you this one in the quiz. Now, in the increase of the immunity system activity, I decided to do another true or false question with these two particular bullets over there. You need to be extremely careful how you read the question because exactly what you expect, I will do some kind of mix it between those two. I will do a beautiful drink over there with all the different layers inside of that beautiful drink, meaning that you need to be extremely careful how I mix those particular bullets over there. It's a true or false, and I think again that is only in one test of four. Moving on immediately. I already have experienced some connection issues. I don't want to break this one immediately. Now, autoimmunity, I already mentioned in this one in all the classes. I will go now with these two bullets. That definition is extremely important. It's a true or false question also, and it's just in one question so far. Remember that the purpose of the immune system always is not only to defend your body, but also to recognize that every part of you belongs to you and is not a foreign invader. Meaning an individual immune system recognizes its own cells, mounts an immune response that injures the cell tissue, and that is the problem sometimes when the immune system basically has some kind of defect. Now, careful with those two bullets. Again, true or false is basically one question in one test. Moving on immediately. Exactly what I mentioned in the class, I decided to remove the theories, meaning that I will jump this one. In this particular case, I will want to emphasize that. Remember that without the thymus gland, will be impossible for us to mount a beautiful defense system, meaning that the thymus play an important role in that particular mechanism of immunity, meaning you need to remember that and what will be the consequence if a person have a problem with that gland in the first years of life, okay? Meaning careful with that. I will try to trick you out with those two bullets over there, T cell theories, and obviously the thymus gland, the importance obviously for these particular white blood cells, the presence of that thymus gland. Again, true or false question, and there is also a multiple choice in related to that question. Possible theories of the B cells. This one pay attention just to this one. I have over here a true or false this time. As you see over there, I did a final cut. In some classes, I was removing some of the slides. I decided to put it back to make sure I have all the questions for all the different tests. And this second bullet is essential because you will see it in a true or false in one test and in a multiple choice in another test. Okay? Well, somebody will see it like a true or false, somebody will see a mix in the multiple choice. Careful with that mass theory, and the cytokines are released causing activations of other cells. Cytokines, you can see it basically like a messengers to attract help from the white blood cells inside of that particular body. Moving on over there. Okay, let's move on. I don't know why some people is still asking me, send me this message. We have some kind of online session because I sent an email this afternoon, not only with your powerful points on the next week, but also remind you that we have a beautiful online session tonight. Meaning, please make sure that you're reading your emails like a responsible professional, healthcare professional that you want to be, because that could be something that I will take in consideration. Now, autoimmunity, very important. I have multiple choice with this one, and you will see this one in 2 or 4 tests, meaning that is an important one over there. Yes, just that final bullet over there, Hoopa. Just that's the last one over there. I have a multiple choice from that one. You have a true or false. The genetic factors, different cytokines, meaning different messengers that are associated with the autoimmunity. And remember that I mentioned these particular genes that are associated, obviously, with some autoimmune diseases. And the ladies, obviously, are the ones that are always in high risk. I have a multiple choice in 2 different tests in regarding this particular PowerPoint. Moving on over here. I decided to remove this one out. In the treatment, again, if you don't know how the diseases attack the human body, I don't want to go to the treatment yet. I will do treatment a little bit further. We enter in another important chapters later on, meaning that this one is also out. You have your question for yourself, or you can leave you over there to practice them. And then we enter to hypersensitivity. You remember in this particular chapter, we saw 4 hypersensitivities: type 1, type 2, type 3, type 4. Normal immune response that either inappropriate or trigger that is excessive and produce different undesirable effect in the body. Here in this particular PowerPoint, please pay attention to the basic mechanism over here. That is basically what is related to a question, multiple choice in one test of 4. Okay? Let me see over here. Let's move on to the next one. We go the 4 sensitivities. Pay attention in these particular slides because I will try to trick you out, especially who belong to the hypersensitivity type 4 and basically who are related to the other 3. Remember that the first 3 are basically related to the antibodies and produced by the B cells, lymphocytes, and the hypersensitivity type 4 are related by the T cells over there, meaning that I will try to make a true or false, or I will say the true or false is already done, that is related to these particular fellows and is in one test of 4. Okay, meaning that you will see a question regarding this particular slide. Now, in the next slides, I create a huge multiple choice that will take all of this. This is part of the multiple choice. Continue with this one. That is part of the multiple choice. And then I will make a tiny jump because I didn't include this, but include this part over here, meaning that this particular PowerPoints are basically part of a huge multiple choice. Again, 15, part of the multiple choice. The second one, part of that multiple choice too. And the pathogenesis, part of that multiple choice too. The one that I eliminated was 17 over there. And this particular question, you will see it in basically in 2 or 4 tests, meaning that there is a huge possibility that somebody will see this question. Another question that somebody will see is this one. It's exactly a multiple choice. I will try to basically ask you the different mediators that can create inflammatory response. And you have histamines, heparin, proteolytic enzyme. There is a question regarding that, and it's in one test of 4, and it's a multiple choice. The other multiple choice that follow is this one. I created a multiple choice. This one is in 2 or 4 tests, especially the causes or the factors of histamine. You have the different options over here. Okay? That's how I did that multiple choice in particular. Moving on to the next one. In the clinical manifestation, I decide for this moment not to ask you anything because some of these particular topics are basically related to something that I will say later. That's why I remove this one out. The same thing happens with the treatment. In this particular treatment, I will move them out. And there is a question. Yeah, I want to make myself clear. This is a multiple choice. It's a tiny, I would say, case in where you will have a patient and basically what is the reaction that is going on in that patient and how you need to manage that patient. Well, you have the answer to that question over here, meaning in a reaction that is hypersensitivity 1, probably anaphylactic shock like you see before. What is the assumption that you will do in regarding the antibodies that that person will possess in that particular reaction? Obviously, is IgE, and obviously what will be the therapy for that person that had that anaphylactic shock, the famous EpiPen there. Meaning, this is the answer of a multiple choice in 1 of 4. Okay? Moving on to the next one. In prevention, I decide to remove this one out. And then we enter to the hypersensitivities type 2. Exactly what I mentioned, this is a multiple choice, but it's only in 1 of 4. The beautiful thing to have 5 chapters for a quiz is that you have plenty from where you can do several different questions over there. We don't over there. Okay. In the next one, in transfusion reaction, I will ask something about transfusion reaction, but it's not related to this, and it's related to the famous hemolytic disease of the newborn. You will have 2 kinds of question. One, obviously, is this one. This is a multiple choice, 1 of 4, exactly like this. And there will be another 2 tests that is another kind of question that is related to this, meaning there is variance of the same topic. You need to be extremely careful because I don't know which variant you will get, but this information is related to those 3 questions that are very similar. Just one of the question is almost exactly like this. The other 2, obviously, you need to understand this to make sure that you can answer correctly. And the following particular slide is also involved over here in that question, meaning the previous and this one is part of those multiple choices. And again, many people will see this one because I see there is 3 or 4 tests that possess this particular information. Now, in regarding the myasthenia gravis and the grave disease, at this moment, I decide to remove this one out And the reason for that is because, believe it or not, we will need to go through these ones later on again. And because if we need to see it again, I will try to at least make the things a little bit more bearable. And I will not want to repeat the same thing twice. In the same thing happens with the graph rejection. I will not go with this. You can leave it away. I told you that I will remove type 3 from this particular quiz, meaning that it's out. There is some particular thing that I will ask for hypersensitivity 3, but it's not this, meaning that I am jumping. All of this is out. But in pathogenesis, I have something that you need to know, meaning that the pathogenesis, you will have a multiple choice in one of four related to this one. Very important, pathogenesis of hypersensitivity 3, because the reason why I will ask this one is because involve the complement system, and you have two subjects that are related to the complement system over there. Okay, meaning careful with this one, that is part of that particular question. The next one, you see over here that the phagocytic sect basically destroy or break apart, basically with the inflammatory response, but I will not go with this. You have the smaller immune complexes, circulate for longer period, may increase the immune response. I will not go with this. And the same thing with the large complexes, I will not go with this. And the reason for this is because we will look to this particular situation when we enter again in kidney. And in kidney, we need to talk the subject again, and we will go in details when we reach over there. The same thing happens with the intermediate site complexes, meaning that is they are out. And this one in particular, I want it. This is a multiple choice. This is one of the things that I will pull out from the particular hypersensitivity type 3. This is a multiple choice in 2 or 4. Okay? Very, very careful with this one. Immune complex glomerulonephritis, as you see over here, very related to the kidney, and I will see that when we enter to the kidney with more detail. That's why I want to give you a preview when this particular information starts to show up in the material. The next slide, I need to ask you something. It's a multiple choice too, and it's like like to say lipis, meaning that this particular one, you will see it in a multiple choice too. This one just in one of four. Okay. Finally, we enter in the type 4 hypersensitivities, tissue damage resulting from delayed cellular reaction to an antigen, no primary antibody involvement, principal mediator lymphocyte. Careful with that. There is a multiple choice related to this, and it's one of four. I like to switch the mediators. I like to say something else over here. Sometimes even remove the no out of the way, and the people fell for it, meaning that anything over there can change the sense of that sentence. You need to be pending and pay attention to every sentence over there. So if I already give you from where I put the question out, I think that at least you can go through that particular PowerPoint several times until you can grab it over there. Okay? Yes, I know. Again, this is part of the previous one. I basically put this one out from there to the multiple choice, meaning that this particular bullet belonged to the previous slide for the particular multiple choice question. Okay? 104. In the next one, I decide to remove this one out, but I have a multiple choice. I will call this one a freebie alert, because I basically put them in the quiz exactly what you have it over there. I just change something over there. I include something else over there, but it's not there. It's because it's false statement, meaning this is a multiple choice, and 2 or 4 quizzes will see this particular multiple choice exactly like that. I didn't change anything else. The next one over here, everybody is very familiar to the tuberculin type hypersensitivity. I decided not to ask you for this one because everybody at least have an idea what we are talking about. The next one, the granulomatosis hypersensitivity. Yes, I have a multiple choice for some of you that can basically give you some kind of memories because it's related to that granuloma or that picture that we saw necrosis in the previous quiz. There is just one question forward that will have this multiple choice. Okay? Moving on to the next one. I jumping one particular slice of questions. I will leave that one to you. And then you have the problem with the immune response that you have two types, primary and secondary over there. At this moment, I decide to remove this question out. And you have what happens when the immune system is affected for any kind of problem, all the different layers of protection that are basically affected. I didn't ask you for this one either. Now, careful with this. The primary immunodeficiency disorders may be congenital, genetics, or acquired defect that directly affect the immune cell function. You need to know that. You need to know that they are rare and some of them often sex too, the chromosome, sex chromosome over there, and they have huge amounts of indicator with signs and symptoms of infection, meaning that you have a multiple choice over here in 2 of 4 quizzes. These particular slides go with the next one to complete the multiple choice, these two, meaning that you need to know this one too because it's part of the multiple choice in conjunction with the previous one. Okay? Again, this is a multiple choice with the previous one that will show up in 2 of 4. Next one over here, I have a beautiful freebie alert for some of you because they will see this particular question at the end, this bullet only, and this is a true or false. A true or false that only will show up in 1 of 4 quizzes over there. I'm telling you that I just copy paste over there. I did some interesting changes in that sentence, meaning careful with that statement. That is a beautiful question in your test. The other question that I have in this category is the George syndrome. Very interesting syndrome. Believe it or not, most of these particular patients, because I have experience with them, they don't survive for too long. And some of them can, by I would say almost miracle, reach to the 18 years of age. But no, most of them reach to the adulthood. They die too young for all the abnormalities that they have. Again, this is a multiple choice. You will see it in 2 or 4. Yes, in the previous one, you syndrome that you saw over there, Wiscott syndrome. That is correct. This one is a multiple choice completely over there. I would add something else, or I would try to guide you with something else. The next one, the famous chronic mucocutaneous candidiasis, I will not ask you this one right now because we will go through this one later on again. Now, in this question, careful with this one, you have a multiple choice but using 1 of 4 tests for this slide. Okay? Because they are 4 different tests, that's why now we have more questions and more slides to review because I don't know which test you will get. And this is a particular question that will show up in one of the tests. By the way, I have in front of me. Now let's go over here. Let's go to the next one. The transient hypogammaglobulinemia. I will not go with this one. I will explain something when we reach to the, I would say, problems with the liver, because remember that the liver is also another important organ in the production of antibodies. We will see that one later on and other proteins. I will jump to the next one. Factors that excessive or defective neurologic response. Basically, is definition we have over there, but I decided to remove this one out. And reaching basically the end of this chapter already, factors that can also affect in the immunodeficiency. You have it over there, but I decided to remove this one out. At this moment, I will do a stop for this chapter to stop the recording for chapter 10, start immediately chapter 11.